Good afternoon and happy American Heart Month. My name is Kawita G. Adams and I will be serving as your MC today. I am the board chairperson for the Capital Region American Heart Association, Core Vitae Society member, and Paul Dudley White Legacy Society member. I am excited about today's events because the Check It Challenge coincides with my reasons for being an active member of the board and strong advocate for the American Heart Association. First, my why is deeply personal, as my father passed away at the age of 67 from hypertension, stroke, and heart-related complications, which could have been prevented through education and follow-through had we known more about heart disease, stroke, and hypertension. Secondly, as a person of color, the research shows that African Americans, and specifically African American women, are at greater risk of heart-related complications and greater risk of death due to hypertension, heart disease, and stroke. We have to go beyond awareness and move into action in order to live healthier lives, build stronger communities, and yes, live fierce. Thank you for joining us for the Check It Challenge community conversation, How to Manage Blood Pressure, presented by Baxter and the Kennedy Drugs Foundation. The Check It Challenge is an evidence-based 4-month wellness blood pressure management program that focuses on improving our health by making simple changes to prevent and manage high blood pressure. Guthrie Health is proud to be a sponsor for the Check It Challenge, and especially the 28-day journey to better health and better health paths to help you achieve your health priorities. These journeys provide you with daily emails and reminders with small tips and nudges to help you make the changes you want. Choose from manage blood pressure, eat smart, or move, and move more. Start your journey at www.heart.org/Guthrie. Today's session is the first in a series of monthly webinars that will be offered through the 2024 Check It Challenge. Organizations and individuals are encouraged to sign up and learn more at www.heart.org/CheckItNewYork. The Check It Challenge is proudly sponsored by Guthrie, Broadview Federal Credit Union, Baxter, the Kennedy Drugs Foundation, and media sponsor CNY Latino. You are going to hear from some amazing speakers, but these events are entitled Conversations. Before we get started, we'd like everyone to introduce themselves in the chat box. Add your name or company to where you are joining us from. We want you to get used to using that chat box because this is also where we will want you to place your questions, and we will get through as many questions as we can during the Q&A section at the end. As a reminder, this is a public event, so please avoid disclosing any personal medical information when using the chat feature. We are recording this session today, and it will be available on the Check It Challenge website, American Heart Association New York State Facebook event page, and the American Heart Association's Eastern States YouTube channel. You can access all of these materials on the event website, www.heart.org/checkitnewyork. If you are using social media through this conversation, please use the handles you see on the screen at AHA New York and #CheckIt. Our first speaker today is Dr. Saurabh Sharma. Dr. Sharma is a Guthrie cardiologist leading the Cardiovascular Prevention and Lipid Clinic, as well as the Internal Medicine Residency Program. His career spans long and wide from Brooklyn to Philadelphia. With this extensive experience, his expert care has impacted the lives of many Guthrie patients. Dr. Sharma, thank you so very much for joining us today. Can you share with us some of the basics on blood pressure and why blood pressure is important from your perspective as a cardiologist?
Thank you, Kavita, for having me today. It's a pleasure and my privilege to be here. That's a great question, Kavita. Blood pressure is very important, but before we understand why it is important, let's just understand what is blood pressure. So blood pressure is the pressure which is actually in the blood vessels of the heart, and it is the pressure at which the blood runs. It's a pressure of the blood pushing against the walls of the blood vessels. And there is a top number, there is a bottom number. The top number is called as a systolic blood pressure, and the bottom number is called as the diastolic blood pressure. And both these numbers are important. Why blood pressure is important? Because there's a certain amount of pressure that is required to be in our body to maintain proper perfusion of the vital organs of our body, your brain, your heart, your kidneys, your liver. However, if the blood pressure is lower than usual or higher than usual, then it can create some damages to the body.
Hey, thank you so very much. We talk about modifiable versus non-modifiable risk factors and conditions. How that also interacts with the Life's Essential 8 from the American Heart Association. Do you have any thoughts about that?
Yes, so when we talk about modifiable and non-modifiable risk factors, these risk factors are for overall cardiovascular health. And as you can see in this particular slide here, obesity, diabetes, tobacco use, dyslipidemia or elevated blood cholesterol levels, they are modifiable risk factors. Sedentary lifestyle and even hypertension that we're talking about is a modifiable risk factors. The non-modifiable risk factors includes, your age, race, and ethnicity, which one cannot modify. Even family history of premature heart disease is also considered as a non-modifiable risk factor.
You bring up the fact of non-modifiable risk factors and ethnicity. And as you know, February, not only is it Heart Month, it's also Black History Month. And so we are addressing heart health and concerns in communities of color. Dr. Sharma, could you please speak to the disproportional rates of hypertension in Black and Indigenous communities, as well as people of other ethnicities?
Yes, sure, and that's a very excellent question, Kavita. Unfortunately, in the United States, there are healthcare disparities that we struggle with, and certainly the hypertension actually disproportionately affects certain racial and ethnic groups. Research suggests that individuals of African descent have some genetic predisposition to developing hypertension, as you can see in this slide here, there are some statistics that are available. The Black Americans and our African Americans are 40% more likely to have hypertension. 50% Black women more than 20 years of age have high blood pressure. Black women have highest prevalence of stroke. 1/3 of African American women have more than 3 cardiovascular risk factors. They also are more likely to develop preeclampsia or preeclampsia-related complications. So yes, we are struggling with the healthcare disparity, and If you think about the reasons behind it, I would say there are like the genetic factors that I just told you, but there are also some socioeconomic factors like income, educational level, employment status, and access to healthcare that also plays a significant role in the prevalence and management of hypertension. We know that the Black and Indigenous communities often experience a higher rate of poverty, unemployment, and limited access to healthcare that plays certainly a role in this disproportionate hypertension care and the prevalence of hypertension.
Thank you so much, because that awareness is extremely important. And so let's take it to the next level now. If hypertension is uncontrolled, and we know the risks because you've talked about that, but what can that lead to if hypertension is uncontrolled?
Yeah, so as I told you before, that blood pressure is important to maintain adequate perfusion pressure, but if the blood pressure is really high, it can create problems. And as you can see in the slide here, if the blood pressures are elevated in the brain blood vessels, then it can create strokes. If the blood pressure is high in the heart blood vessels, it can create heart attacks and heart failure, even sexual dysfunction, kidney disease, and sometimes vision loss.
And those are all very, very serious side effects or risks of uncontrolled hypertension. So let's talk a little bit about self-monitored blood pressure. And I'm going to ask you just kind of a series of questions, but I think your response will be all-encompassing. In self-monitoring blood pressure, how often should we check our blood pressure? What are the benefits of knowing our baseline numbers? And what are the best ways to check our own blood pressure? And when should someone feel that urge or the need to go ahead and talk to their doctor if they're seeing some numbers fluctuate?
Yeah, we get these questions a lot, Kavita, and I think it's an important question that we need to understand the answers to. How often we should check our blood pressure? Well, it depends. If you're a healthy adult, I would suggest measuring your blood pressure at least once every 1 to 2 years. If you are a patient who has some individual risk factors, like I just told you about the modifiable risk factors or non-modifiable risk factors, then at least keeping an eye on your blood pressure once a year is important. For individuals who have a diagnosis of high blood pressure, they should check their blood pressure more frequently. I would suggest every time they see their doctor, or every time there is a change in the medication of hypertension that they have. Your next question was about how beneficial it is to know one's baseline. It is, I would say, beneficial because in the sense if your blood pressure runs a little bit lower, less than 120 over 80, and you're asymptomatic, it is okay to have that blood pressure run a little bit lower. For example, so I see some of my patients whose blood pressure run around, less than 100 millimeters of mercury over less than 80 millimeters of mercury, but they're asymptomatic. They have no symptoms, and that's why I think it's okay for them to have that baseline blood pressure. The best way to check your blood pressure, it's very important to check your blood pressure at home. There are various devices available nowadays to check blood pressure, but I suggest all my patients to first, completely relax for at least 5 minutes. Make sure that you have not exercised, walked or climbed up a stairs, have coffee, not more than an hour before you check the blood pressure. You should sit on a chair comfortably. Your legs should be touching the ground, and your arms should be resting on a table. And then you should, if you're checking your blood pressure with a cuff based blood pressure instrument, then the cuff should overlap the arm approximately 80% of the area. You should check at least 1 or 2 readings, at least 2 to 3 minutes apart, and take an average of that reading.
Okay. Thank you. In closing, as a physician, what is the one thing that you would recommend everyone on this webinar today do to work towards blood pressure control?
See, the American Heart Association, excuse me, the American Heart Association came up with this Life Essentials 8, the 8 things that we need to focus on. I tell my patients that imagine these 8 things are holes in a bucket, Imagine your bucket is life and your water, and the water in the bucket is your health. If you need to make sure that the bucket of life remains full with healthy water, we need to take care of each of the 8 holes, not one, not two, all of the 8. So if I need to choose to do one thing, I would basically choose to focus on all the 8 essentials of life.
Dr. Sharma, I see what you did there. It's not just one thing, it's all
It's not
8.
just one.
So
Yes.
awesome. Thank you so very much, Dr. Sharma. If any of you have questions for Dr. Sharma, please make sure that you put them in the chat for our question and answer session later as we move on to our next guest, Dr. Natalie Powers. Dr. Powers began working as a pharmacy clerk at Kinney Drugs in Clayton, New York, when, get this, when she was just 16 years old. She served as a pharmacy intern and earned her Doctor of Pharmacy degree in 2014. Dr. Powers joined Kinney full-time as a pharmacist and was promoted to supervising pharmacist in April of 2015. She is currently the supervisor of medication therapy management and clinical operations. Dr. Powers, welcome to the conversation, and it is great to have you here today. Also, thank you to Kinney Drugs Foundation for their continued support of the Check It Challenge. Dr. Powers, thank you for being here.
Thank you so much for having me here. It's truly a privilege to be part of this community conversation this year.
Thank you. As a pharmacist can really play a critical role in managing and controlling blood pressure. What role does the pharmacist play and have in controlling blood pressure?
Absolutely. So as a pharmacist, we're generally the most accessible healthcare provider. So in a retail pharmacy, we are there. We're readily available for questions. There's not a copay or an appointment that has to be made to go talk to your pharmacist. So we're often that go-to healthcare professional for both not just medication advice, but a lot of times medical advice too. In addition, when it comes to blood pressure, we also have kiosks at all of our pharmacies where a patient will come in and they're able to sit down and take their blood pressure, and we can certainly chat with them about any medication related problems, help improve adherence to medications, and so forth.
Thank you. So this question is a little bit different. It's estimated that 3 out of 4 Americans do not take their medication as directed. What are some of the barriers that people face, and how can these barriers be mitigated? And what suggestions do you have to help them remember to take their medications and make sure that they're taking it properly?
Absolutely. So it's quite the statistic, 3 out of 4 Americans, but I do see it every single day. So taking your medications as prescribed is so, so important, not only in blood pressure medicines, but any medication, but especially with blood pressure and cholesterol medicines. You know, you might not feel differently when you're taking the medication. So a lot of times it makes a patient think that, oh, maybe this isn't doing anything, but in reality, it's super, super important. Some common barriers that people do face is drug interactions, possibly affording the medication that's prescribed. And again, if they're feeling good, they might not think that they need the medicine. So as a pharmacist, we do talk to patients all the time about cost-saving options, potentially a medication with less side effects or drug interactions, and just the overall education on the importance of taking that medication and taking your blood pressure when you're not feeling well. We also have a lot of automatic refill programs. And this is where we ensure we fill your medication, we have it in stock, and we also can contact your doctor for additional refills if you don't have any before you run out. So these are all different ways we can help with that adherence factor.
You mentioned something really important about the interaction with other medications, but when taking blood pressure medicine, is there anything else that we would want to avoid?
Absolutely. So there's a lot of different medications, drug interactions like Sudafeds, different anti-inflammatories, things that you may not know because you can purchase them right over the counter. So those things can definitely increase your blood pressure. So it's always important to go seek the pharmacist if you have a cold and you want to grab some cough medication. Or, you know, we can talk to you about caffeine intake and lots of different lifestyle modifications as well.
If hypertension doesn't really have any signs or symptoms, how do we know that the medications we are prescribed are really working?
The best way to know if your medication's working is to check your blood pressure regularly. So there is many at-home blood pressure monitors. They're easy to use. A lot of them are affordable, and sometimes insurances will even help to cover the cost. And you can always ask your pharmacist. I go out on the floor all the time with patients to help them find a monitor that will fit their lifestyle. Some monitors are really fancy and they connect to Wi-Fi and they can run reports, and that's great for certain patients. And then other patients might want just a very simple monitor that just shows, those three important numbers, your diastolic, your systolic, and your heart rate. So we always are there for you to go help you choose a monitor. They also have finger and wrist monitors. We really recommend that regular cuff blood pressure monitor. We feel that those are the most accurate.
Okay. You talked about the kiosks at the pharmacies. What can individuals do to get the most accurate reading? And let's say that I go and I get a reading and I may be a little bit confused about it. Will the pharmacist recheck my blood pressure for me?
Absolutely. We do this all the time. So most pharmacies or grocery stores with a pharmacy, and then they have a blood pressure kiosk that's usually right next to the pharmacy. Sometimes usually a pharmacy is in the back corner of a store. So when you go in, our patients walk all the way back there. So we always recommend just having a seat, relaxing for a couple of minutes and not sprinting to the back and jumping right on the machine. So just relaxing a little bit before you check your blood pressure, keeping both feet on the floor, and avoid just talking and having a conversation when you're taking that blood pressure.
So I know a lot of times people are concerned about taking medication for an extended period of time. Once you're on blood pressure medication, is it possible to get off of the medication?
It is. You'd have to also be making some lifestyle changes as well. So a lot of times if somebody's in like a stage 1 hypertension state, then some lifestyle changes can certainly help to take that blood pressure down anywhere from 5 to 20 millimeters of mercury, really, if you're making big lifestyle changes. So if you're not making those lifestyle changes, you're probably going to have to be on that medication. And there's many different medications we can add or remove or, make lots of changes that way. But just because you have to go on the medication doesn't mean that you'll be on it for life if you're willing to make some lifestyle changes as well.
Okay. And finally, what are some frequent questions that you get asked as a pharmacist about blood pressure medications?
Absolutely. So when someone is initially prescribed a blood pressure medicine for the first time, that's when I really see the majority of questions. Like, what's this medication for? How does it work? When should I take it? Should I take it in the morning? Should I take it at bedtime? Are there side effects? Should I avoid certain things like driving or exercising? Is there foods I should avoid? And what happens if this makes my blood pressure go too low? So these are all amazing questions. We're happy to help answer these. And a lot of the answers really depend on the specific medication that you are on, and if there's any interactions in any of the medications that you're using. But as I stated earlier, our pharmacists are accessible 7 days a week, usually morning to the evening. So we are there for you. So please don't hesitate to ask us questions. Just being informed really helps you understand the importance of remaining adherent and making the biggest difference in your life.
Thank you so very much, Dr. Powers. You provided some great information. And next time I go to my pharmacist, I'm going to start asking some of those questions too. So thank you so very much. Just a reminder to our audience to please put any questions that you may have in the chat box. Now we'll move on to our next guest, Ms. Nakia Chambers. Ms. Chambers is an American Heart Association board member from the Central New York area. She spent over 2 decades standing at the intersection of social justice and cultural change. She has served at SUNY Upstate Medical University since 2006 and in the offices of student admissions, student affairs, affirmative action, and diversity and inclusion. She presently serves as the Director of Multicultural Access and Programs. Welcome to our conversation today, Ms. Chambers. It is a pleasure to have you here today.
Thank you. It is a pleasure to be here and serve with this amazing organization, to speak with you all today.
Thank you. At the American Heart Association, February is American Heart Month, but we are also celebrating Black History Month, a time to focus and celebrate on the contributions of African Americans past and present. Ms. Chambers is here to share a few highlights of Black history from Syracuse, New York, as it relates to the medical field. Ms. Chambers, could you please share with us about Sarah Logan Frazier and who she was and her contribution to the medical science field?
Absolutely. Just allow me to share my screen briefly. I will do that. So just to start you off, Sarah Logan Frazier, Dr. Sarah Logan Frazier is celebrated as being the first woman and first Black woman to graduate from Syracuse University College of Medicine. She graduated in 1876, also making her the fourth Black woman in the nation to receive a medical degree. And during those times, as a woman, and especially as a Black woman, those type of things were really unheard of. And so definitely it was very, challenging in order for her to do that, right? So her medical practice focused heavily on pediatric and obstetric care. And it was also due to a lot of personal inclinations that got her involved in medicine. Just advancing. So looking at it, she was the daughter of abolitionists, right? Her father, Reverend Jermaine Wesley Logan, moved to Syracuse as an escaped slave, first migrating to Canada and then settling down here in Syracuse, and married her mother, Carolyn. The both of them served as abolitionists and actually individuals who were very instrumental in the Underground Railroad. He is celebrated for harboring and helping to free over 1,500 slaves to escape to freedom in Canada. Her father is actually referred to as the Underground Railroad King, and he worked very diligently in order to do that. Their home, which is located in Syracuse on the corner of East Genesee Street and Pine Streets, there's actually a marker that is there that celebrates the work of her father. And alongside with that, working with Harriet Tubman in those efforts. He was very instrumental in also the story of Jerry Rescue, which was a fugitive slave who was escaped capture during the Underground Railroad times, whose statue is downtown here in Syracuse. She lived during extraordinary times, right? So we talked a little bit about this. During the Underground Railroad, fugitive slave laws. But what really got her interest into medicine and helping others was the work of her parents. Many times she had a lot of the slaves living in her home. So she was bandaging wounds. She once helped Harriet Tubman bandage the wound of a little girl that was coming through her home. And so it got her interest spirit in helping others and giving back. She also had a lot of loss of her loved ones. She was 5 of 8 children that lived in her home. She had a younger sister who passed away when she was 5 years old. She had a brother pass away when she was 11, and then she was only 17 and 22 when her parents passed away. So she had a lot of loss in her family as well. Going through it, she also knew, who to get advice from. Being with such a prominent family, she actually had as a family friend Frederick Douglass, who she saw as a mentor. And she also looked at one of her professors who actually got her into looking into medicine, Michael Benedict, who actually told her and convinced her to apply to medical school. This is actually a picture of who she knew not to listen to. So this was one of her classmates that had some interest in her while she was in medical school and actually told her that she should not continue on in medical school and marry him because she would gain more, I guess, prestige as being his wife instead of being a doctor. And she declined his offer, declined his proposal, and looking in that. This is actually a photo that resides here in our library and artifacts in upstate. This is actually her graduation photo. Fraser was admitted to Syracuse University School of Medicine at the age of 23. During that time, her enrollment was celebrated in the Syracuse newspapers. It was an issue in the forefront of women's rights that were moving in the right direction. And she sort of opened the doors for women, for not only women, but also Black women. After graduating, she began interning in pediatrics and obstetrics at Women's Hospital in Philadelphia, and then continued on to the New England Hospital for Women. During this time, again, women's suffrage movement. So at that time, she could only serve women and children in that capacity. So she actually developed and did some research in a couple of things, looking at the way color and art therapy engaged in the process of helping people in a hospital setting. Probably most prime, she became the first woman doctor in the Dominican Republic, right? So she was introduced to her husband by Frederick Douglass. He was a chemist by the name of Dr. Charles Fraser. They were married in 1982, and shortly after had their daughter, Gregoria Alexandriana. And she actually moved to the Dominican Republic, where they actually opened a pharmacy. Till this day, she is still praised in the Dominican Republic. She was known as Miss Doc. After a while, her husband passed away in 1894, and they owned a plantation and the pharmacy. She was unable to do both, so she returned to the United States. Once returning to the United States, she found out that our country, was divided on many different areas, not only in regards to gender, but in regards to race. So what she did is that with the money that she had from private practice, the pharmacy, she actually sent Gregoria to be educated in Paris because she did not want her to be educated here in the States, where there was so much injustice occurring. For the last 30 years of her life, she lived between Syracuse and Washington, D.C. Coming here locally back to Syracuse, she worked at a local school while also working with local midwives and working in pediatrics, and sometimes offering care to the poor right here in Syracuse. She also worked with our local native tribes of the Iroquois nation and trading, sort of birthing practices while she educated midwives. She died in 1933, and I'm going to stop sharing. She died in 1933 with kidney disease and Alzheimer's. She's actually buried in Maryland, but there is a marker for her family at the intersections of Columbus Avenue and East Genesee Street, where there's a park. It's the Sarah Logan Fraser Park. And there's countless things here at Upstate, which is the predecessor of Syracuse College of Medicine. So we take pride and ownership of the life of Dr. and legacy of Dr. Sarah Logan Fraser.
Thank you for sharing that information, because what a pioneer during a time when it was unheard of. And despite the limitations, she was a huge contributor in both the United States and the Dominican Republic. And so thank you for bringing that to our attention and helping us learn a little bit more. And then I'm going to kind of extend this to, especially tied to your role that you do every day. Why is it so important to acknowledge this history of the contributions of people of color and of African Americans, so that we have that diversity in medicine? But what is the significance and why is this so important to us, not just in February, but all year long?
It is said, based upon research, that there are better patient, outcomes if they have a doctor or a physician or a clinician or a nurse that looks like them, that can understand what they're going through, that, sort of that they can see themselves in. And so part of my role here is to keep that going, is to keep opening the doors or window so that there's access into our healthcare professions. So if they're saying there's better patient concordance with that, and that we can have better patient outcomes, the right thing to do is ensure that individuals are moving through those seats to become healthcare professionals, and they're more knowledgeable, not only on a clinical or scientific level, but more on a personal level. And so I think that's why it's really important.
Thank you so much, Ms. Chambers. We appreciate what you brought to the table today. Just one of the things that we're going to look at right now, and I don't want to put anybody on the spot, but I am going to ask that our guest speakers today leave us with a call to action or a closing thought or a big takeaway from today's conversation. And I'm just going to go back in the same order, and I'm going to start with Dr. Sharma and then go to Dr. Powers, and then we'll close out with Ms. Chambers. So Dr. Sharma, any closing thoughts?
Well, yes, it was a good discussion about the cardiovascular risk factors, and I know we're talking about hypertension here, but since we have almost 54 participants, probably more, because I know some people are joined as groups. Let me take this opportunity to educate all of us today. My mentor at Mayo Clinic, and who was a preventive cardiologist, used to say, well, cardiovascular prevention is not something that you do one-on-one. It's actually about educating the masses, and that's what we try to do, and that's what we're doing here. Let me take this opportunity to say that we talked about the Life's Essential 8, those modifiable risk factors, and if I know it's difficult to control all of them, and many patients say, Doc, you're asking me to do a lot. I can't do it. I can't eat healthy. I can't even, get up early in the morning to do brisk walking. And I tell them, well, just take baby steps. Do not make a goal for you which is not easily achievable, and that's when we fail. If we make our very high goals for ourselves, that's when we fail. We then get discouraged, and then everything falls apart. Baby steps is something that I like to tell all my patients. Focus on all the modifiable risk factors. I tell my patients that if you need to get the biggest bang for your buck for your efforts, quit tobacco. If you're using tobacco, your risk of developing heart disease in the next 2 years is going to be reduced to half in 2 years. So that's a lot of bang for your buck that you're going to get. Control your cholesterol. The cholesterol was found to be the most attributable risk factors in cardiovascular diseases. So talk to your doctors, follow their advice, be compliant with the medications that you have been prescribed. And we all work in an interdisciplinary team. We have nurses, pharmacists, other healthcare providers that work together. If you have any questions about any of your care, your healthcare provider will be more than happy to assist you.
Thank you. Thank you so much, Dr. Sharma. Dr. Powers.
Hello. Yes, I just wanted to share a really quick story just to show you that your pharmacist is certainly accessible. So I recently just lost one of my favorite patients. He was 97 and he had lost his wife probably about 10 years ago. So he was kind of a lonely guy, and he would come to the pharmacy every single morning just to come check his blood pressure at our kiosk. So I absolutely loved seeing him. I always heard his feet coming shuffling down the aisle, and he would come in and I would say, how's that ticker doing today? And he would have this funny little smile on him, and he'd walk over to me with his little receipt that our kiosks print, and it would be perfect every single time. He wasn't on one medication. He was a very healthy guy, but he just wanted the encouragement and the attention. So the bottom line of that story is that your community pharmacists are here for you in ways far over just dispensing your medication. So we like having that relationship with you, and we don't want you to ever hesitate coming to us. We're happy to help you set timers, find a pill box that helps work best for your regimen, help you create a blood pressure or a diabetes log, so much more. So bottom line, don't hesitate to include your pharmacist in your health journey. We're accessible. We're here to encourage you, support you, and care for you.
Thank you. Thank you, Dr. Powers. And Ms. Chambers.
Yes, I also like to, end with a story. So my why has grown. So recently I lost my mother, and it was a combination of lung cancer and also cardiovascular health. And I remember the past couple of months just going to the doctor with her, and she was saying that she was on high blood pressure medication, but she decided to take it because one day she tested herself and it was lower. So she figured that she did not need it anymore. And as her health got, worse and worse and worse, that was something that constantly came up of why did you stop taking your medication? It was prescribed because it was needed, and not having the proper health literacy to know how to engage that. She actually, passed away due to the combination of her lung cancer and her cardiovascular health. And, and also stroke. And so just having health literacy, I would have to, even talking to your doctor, your pharmacist, individuals who are around you, make sure that I challenge our health providers to make sure that they know, the impact of those conversations happening. So I just want to uplift the message of health literacy and understanding.
Thank you. Thank you. We have a few questions in the chat, so I am going to ask if our guest speakers could come on so that whoever's going to answer, you're right there ready to respond so we can go right through with these questions. The first question is, is there anywhere that can verify that our blood pressure machine is giving the correct reading?
I can take that question.
Okay,
So,
go right ahead.
yes, I was just about to respond by typing in the chat. So our blood pressure monitors at the pharmacy are regularly calibrated by a professional company. So if you ever do have a question about your at-home monitor, you always could come in and take your blood pressure at our kiosk at the pharmacy. And then like 3 to 5 minutes later, sit down and take it with your at-home monitor. And it's not going to give you the exact reading, which is why we recommend taking an average of 2 readings, but it can give you a ballpark idea of what your blood pressure is. It really depends on the brand of the meter that you purchase, because they certainly will come with a manual, and you could always contact the manufacturer of the machine to see if they do any calibration as well.
Thank you, Dr. Powers. Jim McKinney has a question. If my blood pressure is in the normal range, is there any benefit to monitoring more frequently than one time per year?
Yes, I responded to that chat, but I just want to say that yes, if your blood pressure is normal, the only way we know it's normal is because if we keep checking it frequently. And nowadays blood pressure monitors are available over the counter, and all it takes is 2 minutes to check your blood pressure. So I think my suggestion would be to check it more often, just to make sure that this easily preventable risk factor is under control.
Thank you so very much. Are there any other questions? I don't see any others, but if there are any others, please put them in the chat. Well, thank you so very much to our amazing staff at the American Heart Association for all your hard work. Mackenzie is on the line. We have Brittany and also Kathy. Thank you all so very much for all that you do. And Ryan with our technology, thank you so very much. We appreciate you. We thank our speakers today. And of course, we are grateful to the sponsors that you see on the screen for making the Check It Challenge possible. Again, thank you to today's presenting sponsors, Baxter and the Kinney Drugs Foundation. And last but not least, we want to thank each and every one of you in the audience for joining us and for participating today. Your registration from this event gives you access to all the future webinars in the series. The next Check It community conversation is how to eat better and manage health. And it will be on Wednesday, March 28th at 12 p.m. And we hope to see you there. Keep checking your blood pressure. Let us know how you're doing by tagging the American Heart Association at AHA New York on Facebook, Instagram, and Twitter using #CheckIt. Thank you again and have a great afternoon. We're so very excited about this series and we look forward to seeing you in the future. Thank you.
Thank you for having us.